There are many types of congenital heart defects, ranging from those that pose a relatively small threat to health to others that require immediate surgery. For local mother Daniella, coping with Amy's diagnosis and subsequent operation had its challenges, but the support and care she received helped her through that difficult period. Raising awareness is important to her too.
Congenital heart defects can manifest themselves in various different ways. I can only speak about my daughter's personal experience, which is that she had a coarctation of aorta. She was born to us a healthy baby, and within a month we had a checkup where we found out that the aorta was closing essentially, and that's what needed to be opened. We were flown from the GHA to UK. That was incredibly well done, and everything sorted out within a day. And she had her heart surgery on the 25th of February last year.
And what are you hoping to achieve through this public exercise? What are your main aims?
The main thing I'm trying to do at least is just, I don't know if it's the right word for it, calling it a taboo. I'm just trying to raise awareness. People know that these things exist, that these things happen, that families suffer. It's not an easy thing to go through. And it's very hard to try and speak to someone and find, for example, for my daughter, find a nursery where I might have to explain that, yes, there's a scar and there might be things to look out for if she was to become unwell. So really, I'm just trying to open eyes a little bit.
Daniella is using the exercise to raise funds for the Evelina Children's Heart Organisation, which supports families affected.
The way that Echo help is that they are with you from when you're pregnant, really. Most defects are found at a 20-week anomaly scan. So they help out throughout life, up until transitions, which is when the children become adults. And they then move to an adult cardiac rehabilitation, in a sense. Amy, thankfully, might not need extra surgery. She might, in one day, need a stent to reopen the artery if that happens. Other defects, unfortunately, there are some that need various operations within the first months of life. Others that just go on for life. So it just depends on each personal circumstance.
Daniella is using the exercise to raise funds for the Evelina Children's Heart Organisation, which supports families affected. Her public campaign aims to tackle those directly affected too, with Daniella happy to share her experiences and offer advice.
In a way, why I've chosen Royal Calpe, it's a place where we're just having a coffee, and if you want to come and have a chat, it's fine. Until my daughter was operated and I came out asking, I went to social media and put out a post saying, I'm a mother with a daughter with a heart defect, and I know no one else that I can talk to. And it's family is there for me and friends are there for me, but it's hard to speak to somebody who doesn't know what you've gone through. So I'm here, and if anybody wants to come have a chat, either find out more or share experiences, then that's what I'm here for.
Her campaign will run at the Royal Calpe every morning until the 14th of the month, where you can join her for a coffee between 9:30 and 11:30 a.m.